Welcome to Phase 1 of the Connect program. Here we're going to talk about the 4 different chapters or the 4 different stages of Phase 1. But before we get into that, I wanted to make sure that you have some important information, especially where it comes to talking about OT 101 or this core foundational knowledge of occupational therapy. A lot of the times I get asked this question. Well, I have a good handle on OT 101 stuff. Can I skip this section? Or sometimes people will say, well, I've been practicing for 20 years. Do I really need to take the time to do that? Can I skip this section? I guess you could skip it, but I would ask that you don't. The reason why this part is so important is because in order for us to practice in our full scope of practice, and in order for you to have the confidence to use your full scope of practice in the climate in which we work, you need to know the foundations of your profession like the back of your hand. You need to be so convinced that you have proof that everything that you can do is okay to do, that there's no questioning it. The only way to do that is by going back to the basics and by knowing the basics so well. So when you listen to somebody else speak about foundations, although maybe you just graduated, right? Maybe you just graduated, you know the foundations, you know how your teacher taught it, but you don't know how another professional sees it. You don't know how a clinician sees it. So this is going to be helpful in broadening your vantage point and giving you a broader look at what it is you bring to the table as a practitioner. Another reason is it enhances your understanding and application of core principles. When you go through these courses, when you go through these training modules, different segments, I want you to think about how you're going to directly relate it to practice. I'm telling you right now that everything that is found in the BOT portal, all of the theory, all of the models of practice, all of the foundational elements, all of it is profitable for your use in practice. Everything. If you're having a hard time seeing how something is relevant, reach out, go to your Q&A and ask your questions, because you do not want to let any little bit of this program sneak away from you. If you're not seeing the relevance, then you need to do some digging, okay? And we're here to help you with that. So, woo woo. All right. Lastly, refreshment. Who doesn't like a good refreshment? Everybody needs refreshment and reprocessing. You don't even know what is getting away from you. Believe me, every time I come back to this core information, every time I have to reread a textbook before I teach it, every time I have to create new assignments and I'm doing the work before I assign it, I learn something new, or I find things that I completely forgot about that I can apply to my everyday practice. And that's what has boosted my confidence in clinical practice, because I know what I know, and I know that there's proof for just about everything under the sun that I want to do in the guise of occupational therapy. Throughout the challenge, throughout this Connect Transformation program, and throughout the guide, more specifically, you're going to see things that look like this. So when you come across what looks to be like a journal entry area, I want you to do what it says and then write some feedback. I'm all about actionable takeaways. So everything you do here should have some kind of actionable takeaway. When you click the link, it'll bring you to the video, it'll bring you to the PDF. Again, look at it, analyze it, don't move on until you understand it. I'm driving you to these things for a reason, and everything throughout this program is extremely strategic. I've spent years with trial and error and looking through this content and seeing what would be best to include. So please do take the time to understand why you're being driven to that particular thing, and then write it down on the lines that follow. Some important things to remember when you see these types of prompts throughout the transformation guide is it's going to take you to the resource portal. At this point, when you're hearing these words, you should have already watched the orientation of the resource portal. If you are still unsure of what that means, if you have not done the orientation, if you haven't yet been on the resource portal, stop what you're doing, pause this video, and go to the resource portal, take the orientation so that you know what it is that you are walking into. These steps may fulfill specific challenges. So you know already that this program is going to have specific challenges that are going to guide you through the transformation. These prompts may or may not fulfill specific challenges. They may be over and beyond the challenge that's set in your community. Again, we talked about use the space to reflect or write one takeaway from the video. It may pull trainings and videos out of pathway sequence. What do I mean by this? If you have taken the orientation, you know what I mean by this. I have structured pathways that I guide members through in the resource portal. I've also given you links in the transformation guide to these specific sequences. I may not include all of the videos in the specific pathways throughout the book in forms of prompts. Be mindful of that. That does not mean that this information is unnecessary. I believe that everything that I have included and everything that's on the portal is going to be helpful for your day-to-day practice. But again, as always, this is only a guide. This is only what has helped me, has guided my way of thinking, and it has allowed me to experience success, but everybody is going to take the journey differently. Here's a snapshot of what we are going to be going throughout this phase. Phase 1 being content, and we're going to touch on that here in a moment, but this is a snapshot. Okay, you're going to see this throughout your transformation guide. This is just to show you what kind of steps you have going. Remember that you can also use this to actually track your progress. So as you go through these different pathways, just give an X over each of the numbers that you hit. As you do the different challenges, go ahead and just cross them out so that you know that they are completed. I've also outlined these for you within the book so that you can just link to the individual sections. You can know what's going on, okay? But that is what this means. So these are going to represent different titles within the guide to get you through the phase. And then these stars mean that, hey, it's alerting you to go back to your community and look at the challenge. What challenge is associated with that particular spot in the process? All right, so this is actually one of the challenges. One of the challenges is to go through the OT 101 structured pathway. These are the pathways I'm talking about. I do want you to go through all 17 training segments in OT 101. The reason being is because, again, this is foundational knowledge. So even if you know it all, even if you are convinced that you know everything about everything that's included in this lineup, I still want you to go through it. This is a mixture of audio and video. I also want you to be aware that the audio and video are from different points in my career when I was making this content. So you'll hear different beginnings of these media. It's okay. I know exactly what it says, although I've recorded it at different stages in my career and through different initiatives I have done. I still believe that the information is very, very relevant and valuable. So please do listen to it. Again, take a takeaway from it and move through systematically. I do want to remind you that I offer a different vantage point. I am not saying I am the best. I am not saying I am the be all end all of this information. I am just one person giving their vantage point on foundational content of occupational therapy. I always recommend that you continue your searching, you continue your training, and that you hear from multiple people about this type of content so that you have a better vantage point, that you have all different perspectives coming in, helping you make clinical and clinically guided decisions. Okay, so this is just improving your own vantage point by listening to others. It's not so that you can mirror them exactly. Like I said, there's 17 total trainings. They range from 3 minutes to 30 minutes, but I'm so happy to report that with this amazing platform that we have, you can speed up the content. So if you are a fast listener, a fast processor, just go ahead and ×2 feature, right? I love that. I listen to everything at ×2 just because that's how I process information. So feel free to speed it up. Tip: have a journal dedicated to this challenge and write at least one actionable takeaway from each segment. Not only does that tip apply to OT 101, but that tip applies throughout this series. That tip applies to anything that you do in your professional career. Always make sure that you are taking something from it to help shape you into the professional that you were meant to be. That is how you maintain passion. That is how you maintain excellence. It's taking something away from everything. Just briefly going over what you will be experiencing. The first stage is evaluations and assessments, writing notes and goals. The third stage is treatments and interventions. And the fourth stage will be patient education and handouts. How important is this? I cannot wait to particularly get into patient education. We'll see you in the course.